Experts believe an addiction to food should be a psychiatric diagnosis.
I can't explain to you how often I would think about food. You know, I'd finish breakfast, I'd constantly think about it until lunch.
Darren is a recovering food addict, and we're not showing his face at his request because he doesn't want people to know he was once so hooked on food he was dangerously overweight. A new article in the Canadian Medical Association Journal suggests that a food addiction should be treated like drugs and alcohol addictions. One of the authors is Dr. Valerie Taylor. She's an assistant professor of psychiatry and neurosciences at McMaster University and the national mental health lead for the Canadian Obesity Network. And Tammy Keddy is a recovering food addict, and they join us this morning. Hi, ladies. Thanks so much for being here. This is a serious statement, Dr. Taylor, classifying obesity as a psychiatric disorder, similar to a drug. So cocaine, alcohol, food.
Absolutely, and I think the editorial was written more to generate dialogue than to start to make people think that any problems with weight is a psychiatric illness. But basically, you know, an addiction is a pattern of use of any kind of substance, despite the fact that there are negative consequences and despite the fact that the person using the substance wants to cut down.
And Tammy knows all about this. You're a recovering food addict. Tell us a little bit about what you go through day to day.
I've been overweight since I was a child. Roughly in 2003, I chose to have weight loss surgery because of that. Unfortunately, the follow-up wasn't the greatest, and I started engaging in behaviors that, despite my stomach had been altered, my mind hadn't been altered. So I was still having the obsessive thoughts about food, and the fact that I couldn't have food made it even worse. Started engaging in patterns of behavior of overeating, which caused me to purge, 10 to 15 times a day. So it definitely had negative impact on my life completely.
So like a drug, there were highs, and I guess when you don't get the food that you want and you crave, there's withdrawal as well.
Absolutely.
Well, absolutely, and you talk to a lot of people on diets. There's irritability, there's cravings, there's constant thoughts about food. It's very similar to what some addicts experience when they're trying to cut back the use of a particular substance. And it's more complicated with food because you can't just stop. We have to find a way to be able to normalize our eating behaviors. And that's what we're attempting to do, and that's what we want to highlight with the editorial.
And when you drill down a little further, get a little deeper into it, is that food taking the place of something else?
Always, and the reasons, the motivations behind difficulties with weight are really, really complicated. We're calling it a food addiction because we don't have a better term, but I think what we really want to get home is that there are a lot of motivations behind difficulties with weight, behind failures of dieting, and we want people to not feel that they're to blame if this doesn't work. And we just want them to be aware that there are other things involved, and we want health practitioners to be aware that other things are involved.
Just quickly, a couple things that might help people that have this, people like Tammy.
Well, a lot of the same treatments that are actually used in the addictions world are being used in helping people control their weight. In terms of counseling, motivational interviewing is a form of talk therapy that began from the addictions field. It's now being used in dealing with weight difficulties. Cognitive behavioral therapy is another form of talk therapy. And actually at St. Joseph's Healthcare, we put together a cognitive therapy manual on weight management, exactly for that reason, to offer patients another tool to help them achieve a healthy weight and to be comfortable and happy with who they were. So we've been trying to create tools just because working in the field, we know that people have difficulties and we want to give them options.
Dr. Taylor, thanks for being here, and Tammy, thanks for sharing your story.
Thank you.
Really, thanks for being so open. Appreciate it. Happy holidays to you both.
Thank you, you too.